Okay, latest edition of the Westwood Living Podcast takes us to the offices of Dental Arts of Westwood. Happy to be joined by Dr. Dan Kazachkov. How are you, my friend?
I'm wonderful. Hello.
Hello. And Dr. Alana Bednarz. How are you?
I'm doing well.
We did give Dan a hard time. 2 out of 3 of us were in Santa Clara.
We sure were.
I'm glad I wasn't.
Yeah, right, for the pain that we endured having to come back.
Exactly.
True. It wasn't the outcome we wanted.
It is a painful experience when the team you're rooting for loses, right? It's like everything is great until that moment. But
It's hard to watch.
all right, if you've been paying attention to Dental Arts of Westwood's Instagram account, most notably, you may, like I, have noticed that there has been an introduction of some new technology, which really is what drew me into this office today to talk to the two of you. I saw this explosion and introduction of laser technology, which to me was very eye-opening and impressive, but I know nothing about. So when I know nothing about stuff, I go to the pros. And I want to get your thoughts on this new technology that you have introduced. What sets it apart, why you did it, and where you think this whole thing is going in this industry. Dan, I'll start with you.
Well, the way we use laser, Dr. Lana and I, is totally different. I use laser to cut teeth and kind of cook the backs of tonsils to open up throats for sleep apnea patients. And she uses it for more of an aesthetic appeal, so she'll talk about that. We've been using laser for a while on teeth. We've been cutting gums with laser, which is much less painful and abrasive, so it's been kind of something we've had since probably 2015. But we've expanded it into sleep apnea medicine and into aesthetics and became kind of a little bit more involved in that. Yeah, so we were able to cut gums away painlessly for years now, which has been really, really cool. We can even drill teeth with laser, which I don't do much because it just takes more time to do. And patients don't want to be in the chair for longer, so I tend to not do that. But a lot of bone cutting and soft tissue cutting we do with laser. So it takes pain out of that a lot.
Now, if you know anything about Dr. Dan, it's that you being comfortable and not in pain is honestly the number one priority, right?
Always, yeah.
And that goes back to your history. For those who don't know it, give a quick synopsis of how we got here, because your cover story focused on what you experienced as a child, but some people may not be familiar with it.
It was just some light torture, it's no big deal. Yeah, it was just a little root canal therapy without anesthesia, just a basic type of Soviet Russia kind of thing. Yeah, so I had some procedures done on me without my willing participation being involved. And that kind of motivates me to keep patients out of pain and out of discomfort as our main kind of order of business here.
So you obviously know where Dental Arts of Westwood is. You know what it looks like. It's the big yellow building when you get off of the exit here at Route 109 by Route 128. Yeah. And when you walk in, you have 2 stories of just, I don't mean this in a mean way or a bad way, but mayhem. I mean, there are so many people here all the time. You have how many doctors working here now?
Too many doctors, too many people. We have about 7 doctors, 8 maybe now, actually. Yeah, as I go away on paternity leave, we did hire a new doctor. So I think there might be 8 doctors now. Yeah.
Yeah, and as we walked up, Dr. Alana, who's been very quiet so far, we got to get her involved in this conversation.
Oh, heck yeah.
Dr. Alana is typically on the 2nd floor. That's where the orthodontic area is. And Dr. Dan talked about the fact that you use the laser technology very differently. So why don't you walk me through how the laser technology is used in your world?
Yes, Tom, I do. So I am in charge of the aesthetics of the office. And with that, I've had patients over the years who have been doing their Botox, fillers, come to me and say, Dr. Alana, do you have something else? I want more. What else can you do for me? So we researched endlessly for, I would say, a good year about what laser we really wanted to invest in for our patients, and we landed on the Fotona laser. It's truly remarkable what it does. Dr. Dan uses it for sleep apnea to help reduce snoring, which everyone's partner is thanking him for. And for me, I can use that same laser to help with aesthetics. What does that mean? What is this laser doing? Basically, like the number one treatment I would say with this laser for aesthetics is the 4D facelift. It's 4 steps. It's going intraorally, actually, which other lasers don't do. They're all on the skin. This one goes intraorally to help really tighten those tissues, induce collagen, all those nasolabial folds that we don't like and want as we age. It's to help tighten that up and reduce that significantly. It also works on skin texture. It works on tightening, lifting, and also the skin surface, any, things you don't like on your skin that, little scars or this and that over the years we've accumulated. It helps remove all that. So my patients have really been enjoying it. Minimal downtime with it as well, which is key. I usually have patients come in for a session, and I always say it's one session of treatment per decade of life. Okay, so if you're 40 years old, I would expect 4 treatments over the course of every 4 to 6 weeks. You come in for that treatment. We numb you up first, so there's minimal pain with it. I want you to be comfortable and enjoy the experience. And then once you're done with those 4, it's an annual treatment to maintain and continue to look your best.
What jumps out to me right away is that how did you learn about this? I mean, at what point, this almost speaks to the ongoing education that is necessary to be a doctor in this world. Because, I mean, does this go back to when you were in school? I would guess not, because the technology consistently evolves, right?
Constantly evolving. For us with the lasers, it was a combination of our patients asking for it and also, people that sell these lasers coming to us and saying, hey, your office is an office that I think would really thrive with our lasers. So then we're like, okay, well, let's research your lasers and see which one really actually does what it says it's going to do. And it's going to give us those results. And that's why we landed on the Fotona laser.
Very cool. I mean, how many options are there?
Oh, there's so many.
Yeah. I mean, we're talking 20, 50, 100.
Yeah. And some of them, you have to really learn about it and invest and see if it actually works. So we were the guinea pigs to learn, okay, what actually works and what doesn't. Okay. And that's why we landed on the Fotona, because it's the best.
Got it. I do. One thing you said, Dr. Dan, about using the laser and choosing in some instances not to use the laser to cut teeth was because it takes a little bit longer. I want to dive more into that, because is it less, talk about that scenario of a person who, I guess like me, right, 53 years old, gone to so many different through dental procedures my whole life, and I'm just kind of used to the process. You get shot up and you go through the, I guess regular cutting. What would it take for you to convince me that, hey, this may take longer, and I guess how much longer, but it may be less painful or it might be more effective?
It might not need anesthesia is the benefit of laser. So you don't have to numb the tooth at all, because you're slowly anesthetizing as you go. So the advantage is if kids are involved and they're scared of needles, or adults are involved and they're scared of needles. Yeah. You know what I mean? That's where the advantage of it comes through. You can't use it on old metal fillings. There's certain things that you're just not going to, you're not going to set a tooth on fire. That's going to be problematic, and people won't like that. But taking out old composites with it and stuff that, people who are more needle phobic are going to be more attuned to try something like that.
All right. Well, he affected my tease. I was going to bring up the fact that, Dr. Dan's about to be a dad. You blew the lid off that. I was going to lay that out here in the second half of the conversation. But congratulations!
Thank you so much.
So thrilled for you. That's fantastic. When's this going to happen? And then, what do you anticipate happening in the office when you're gone?
I anticipate it's going to be great without me. I anticipate I'll be called in at least twice. I anticipate that. But besides that, I anticipate my wife giving birth fairly soon, any second now potentially. So within this next week, we are due up for our due date. And
ready?
I think I'm ready. As ready as I'm going to be.
It's great. Any pearls of wisdom to your partner over here? What do you tell him about being a parent?
It is the best blessing you ever will experience. It tears you in so many directions. I feel you always want to be their advocate. You want to make sure they're supported, happy, and you guide them through life.
Thanks, Doc.
Look at that. That's good.
Good advice, right?
Yeah, it's great advice.
Solid.
I love it. I had a conversation with our photographer, Rick Byrne, who both of you know, and he actually wrote a great column about the fact how one of the things that's most enjoyable to him is when he sees a family grow up, and he does everything from shooting baby photos to shooting bat mitzvah, bar mitzvah photos, and then graduation photos, and then ultimately a headshot. That I would think applies to your business too, where you see families come through and you are dealing with the onset of normal adult teeth, which then become, let's straighten them out with orthodonture, which then become, we're pulling your wisdom teeth.
Yeah.
Right? What's the
100%.
rewarding aspect of that as doctors?
The
when you see a
patient
family
that you
come
walked
through?
in on was here for 16 years now almost.
Yeah.
So it's and she's I think 22, 23 now. So I've literally seen her grow up and go through her phobias and kind of get through them, and it's very interesting. It's a very unique experience where you get to watch people grow up, and you get to affect the way that they grow up because you don't trigger phobias in their life, which is kind of a big deal where people are afraid of the dentist. They're not going to go. Half of America still doesn't go.
Oh.
It's a wild statistic, but so if you take the fear out of it and you do it at a young age, you see people that are happy to be here. You know what I mean?
Yeah, a lot of
like
smiles.
that, like that girl. Yeah, she's not miserable going to the dentist. Since she's a young kid, she's had things that needed to be changed and fixed and stuff like that, but she's never been affected and traumatized by it. So
That's cool. And then you come into the picture. When do you start recommending that parents start thinking orthodonture?
So this sounds young, but usually around age 7 is when I start seeing these patients, because we're looking to catch little things. Like, let's say I'm noticing that lower jaw is growing a little more than the upper jaw. They have a little underbite, or, their adult teeth are trying to grow in and there isn't enough room. We can do little things at these stages that really set them up for success in the future to have a less painful orthodontic process when they're ready for those full braces.
Awesome.
So even for us, I was telling my team yesterday, we are so lucky to be able to be a part of these patients' lives. We're making a huge change. We're changing their smiles, giving them confidence. They can go out in the world, go on job interviews, feel comfortable and confident to smile. It's important stuff that we're doing, and it's important to take pride in it.
Yeah, life-changing for sure. So calls to action. What are the steps that somebody takes if they want to learn more about anything, but most specifically, because we're focused on it here, the new laser technology? What should they do?
I would have them come in for a complimentary consultation.
call, email, smoke signal, whatever people use these days.
Yeah.
Yeah. Whatever ways they use to communicate with our office, you can go on our website at dentalartsofwestwood.com, and it gets a little text block if you want to text us. You can book your appointment online. So there's just an infinite possibility of getting in touch with us.
Awesome. All right, that's Dr. Dan, Dr. Alana from Dental Arts of Westwood. A lot of good information there. Appreciate your time, as always. Thank you very much. Appreciate your support of what we do. The Athlete of the Month program is one of the most popular things we do. We're showcasing kids every single month. This town is crazy about its athletes. The March issue is going to be the boys hockey team, and I think the upcoming April issue is probably going to focus on the girls hockey team, both of whom just made a fantastic run in the playoffs. So I know that people appreciate that, and it probably wouldn't happen with your support. So
Thank you. Thank
That
you,
is
Tom.
Absolutely.
Thank you.
You've gotten your calls to action. You know what to do. That's Dr. Dan. That's Dr. Alana. As always, if there's someone else you want me to have a conversation with, just reach out. Send me an email, tleyden@bestversionmedia.com. I'll find that person or those people, have a conversation with them, and then share it with you right here on the podcast network. But for now, from the offices of Dental Arts of Westwood, this is Tom saying so long and thanks for listening.